Hello, my name is Madi, Sillitoe, and the topic that I chose to talk about today is antibiotic resistance. So just a quick introduction, the rise of antibiotic resistance is an important and ongoing issue in modern-day medicine. The CDC defines antimicrobial resistance when germs like bacteria and fungi develop the ability to defeat the drugs that are designed to kill them. So just a brief history of antibiotics. Alexander Fleming discovered penicillin in 1928, which was the first antibiotic and really set the stage for the development of future antibiotics. In 1948, a penicillin-resistant staphylococcus was declared a global pandemic once it was found that a strain did not respond to the treatment of penicillin. In 1950, new antibiotic classes are discovered with over 20 different antibiotics. In 1959, methicillin is used to treat penicillin-resistant staphylococcus, but 2 years later, there was a new methicillin-resistant staphylococcus strain that was reported globally. In 1970, over 60 new antibiotics were released into the market, which led to, in 2001, the World Health Organization announcing that antimicrobial resistance was a global public health concern. In more recent times, in 2015 and 2017, there have been discoveries of antibiotic-resistant genes and strains of bacteria that are resistant to all antibiotics. So why is this important? In 2019, there were 1.27 million deaths that attributed to antimicrobial resistance. So once an infection is established, antibiotics are the standard treatment of care. Antimicrobial resistance causes this treatment to fail and means that there's no other way to treat this infection. Antibiotics save over 200,000 lives annually and increases the life expectancy to 5 to 10 years in the United States. The future of healthcare is dependent on finding a solution for this problem, or else we are at risk to regressing to a pre-antibiotic era. So what causes this? On a microbial scale, bacteria and other microbes can evolve and adapt to their environment, which allows them to develop an antibiotic resistance. They can also share these genes with each other through horizontal gene transfer. This allows for growing resistance, specifically in an environment such as a hospital setting. Human behavior also contributes to this with the overuse and misuse of antibiotics. Overuse being defined as using antibiotics at a higher rate than needed, and misuse using antibiotics when not necessary or not using them properly. These two also have overlap with each other, as an overprescription could be classified as a misuse or an overuse. In addition, antibiotics are used agriculturally, as 66 of all antibiotics were used in farm animals and not humans. The excessive use of antibiotics in animal agriculture is a large contributor to the rise of antibiotic resistance. Antibiotics are also used to treat various crops, and as microbes develop resistance to the antibiotics in these animals and crops, the chance of spreading increases. So who does this affect? This affects everybody in the world. However, this issue takes prevalence in healthcare settings. Patients are more likely to be exposed to an antimicrobial infection in a healthcare setting. Antibiotic use is also heavily relied on, and there are lots of hand-on care and chances for exposure. Nearly 2 million Americans per year develop hospital-acquired infection, resulting in 99,000 deaths, the vast majority of which are due to antibacterial-resistant pathogens. So there are some prevention techniques that healthcare professionals can follow, starting with antiseptic techniques, which are methods used to prevent microbial contamination, such as washing hands, sterile and clean tools, etc., etc. Also, isolation, which is ensuring infected individuals do not spread their infection to other patients. Also, just properly prescribing antibiotics and only when it is absolutely necessary. And screening, testing for specific pathogens, even if a patient may seem asymptomatic, because you'd rather be safe than sorry. Geographically, we can see that in 2019, South Asia has had the highest death rate with around 0.4 million deaths. And although we can see that there are regional differences, it is clear that this can affect anyone in any region. So education is the first step. Hearing these statistics can be scary, but it is important to learn about what it is and what the future could possibly hold. I highly recommend this TED Talk that I have embedded in this, where Maren McKenna describes this crisis and her personal opinions on how to fix it. So what can we do? We can spread awareness, we can properly take prescribed antibiotics, we can reduce antibiotic use unless absolutely necessary, and we can adjust our healthcare settings. On the left there's a poster from the CDC that are also saying ways that we can help stop the antibiotic resistance. So in conclusion, antimicrobial resistance is a rising challenge to modern medicine as we know it. It is imperative to learn about this resistance in order to work towards a solution. There are many things that we can do as a society and as individuals to help prevent antibiotics becoming obsolete. As a world without antibiotics and pre-antibiotic era coming to light, it'll be devastating, the results. Thank you so much.